আচ্ছা, প্রফেসর পাঠক, আমরা তো মানে রেসিপ্রোকেট করব যে আজকে তো আপনি ইয়ে করবেন, কালকে আমাকে দায়িত্ব দিয়েছে আবার ইয়ে বিধান।
আমাকে এখন সাবধানে ইন্ট্রোডাকশনটা দিতে হবে।
হ্যাঁ, সেটাই। কালকে কোনো এ ছিল না, তো বিধান বললো যে আশুদা আসতে পারবে না, আশুদা তো ভীষণ ব্যস্ত, আর ওই বিসি হলে যা হয় আর কি।
ঠিক আছে,
ঠিক আছে। আমরা স্যার শুরু করি, ওরা জয়েন হচ্ছে, শুরু করি আমরা, শুরু হতে হতে ওরা জয়েন করে যাবে বাকি।
ওকে, শালাই তুমি বললে আমি শুরু করব, আমি কি শুরু করব?
না স্যার, আমি বলে দিচ্ছি।
আচ্ছা, ঠিক আছে।
Good afternoon, everybody. Now we are going to start our afternoon session, technical session 2. In this session, there is one distinguished lecture by Professor Dr. Praloy Maiti, School of Material Science and Technology, Indian Institute of Technology, BHU, Varanasi. And this session will be chaired by Professor Dr. Tanmoy Pathak, Department of Chemistry, Indian Institute of Technology, Kharagpur. I request Pathak sir to chair the session and conduct this session. Sir, please, over to you.
Okay, thank you, Bidan. Good afternoon, everybody, and welcome to the post-lunch session. I hope all of you had good lunch at home, because Bidan did not arrange for any lunch this time. So this will remain due.
Okay,
when
sir.
the corona is over. Okay, it's indeed my pleasure to introduce today's speaker, and it's actually a great opportunity to know somebody with whom I am talking for the first time. So it's nice to know new people through this kind of webinars actually. So Professor Maiti received his MSc from IIT Kharagpur, our institution, in '91, and did his PhD in 1996 from the cultivation of science. In those days, I think the degrees were awarded by Jadavpur University. So I'm also a student of Jadavpur, so I'm happy to know that we are somehow connected through IIT and Jadavpur. So he was a COE researcher and lecturer at Venture Business Laboratory, Hiroshima University, Japan, between '97 and '99, and was a postdoctoral fellow at Toyota Technological Institute, Japan, 1999 to 2001. He was a visiting scientist at Cornell University, USA, from 2002 to 2004, and was a quick hire fellow at Central Leather Research Institute, Chennai. So from there, he joined the School of Material Science and Technology as reader, IIT BHU, where he is a professor and ex-coordinator of the School of Material Science and Technology. His current research interest includes biomaterials and energy materials, and he has published more than 170 research papers, 17 book chapters, and has 20 Indian patents. That's very good, having patents. He has received lots of awards. I will mention a few because I don't want to eat up into his time of lecture. So he received Professor M. Santappa Silva Jubilee Award by the Society of Polymer Science, India, APA Young Scientist Award by Asian Polymer Association, special recognition of important contribution of research using IUSC facility by IUSC New Delhi. And the list is quite long, and he's also a fellow of West Bengal Academy of Science and Technology, 2019. He has supervised more than 5 postdoctoral scientists, 20 PhD students, and more than 50 undergraduate students. That I believe is some kind of MTech project or MSc project will be that in his laboratory. And one of his recent achievements is the development of injectable cancer treatment and development of metal ceramic adhesive joints. So today he will be talking on materials for healthcare. So over to Professor Maiti, please.
Okay.
I will request everybody to be on the other side of the computer. I promise I'll be here during whole lecture. So all of you please stay around. It's a nice topic actually. Okay, Professor Maiti. So
Okay, thank you, Professor Pathak, for your kind introductions. And at the outset, I would like to thank Dr. Samanto for inviting me to talk about what we are doing at ITBHU. So today, let me share fast. Share. I think now it is okay.
Yes.
So
It is visible.
yes. Okay. So today's the topic decided.
No, but you will have to go to the slide mode, I think. Are you on the slide mode?
Yes, I'm on the slide mode.
Okay. Is it?
It's not the full slide.
Probably it's not. You will have to click on that. Is it on the slide mode?
No.
I'm also not very good at it. So,
okay.
No, sir. Please give it slide mode.
Yeah.
In slide mode,
down in the, you have one
icon.
Yes.
I think it's marked yellow or something like that.
Yeah.
Below at the border.
Yes, but yes, that I did it.
It's not accepting.
It's not accepting. I mean, here I see it's full screen. And say hide video panel. Oh, it is slightly better, or
না actually sir আপনি PowerPoint এ যেখানে দেখুন ফাইল অপশন এ প্রেজেন্টেশন স্লাইড শো থেকে
বললাম
গেছিলেন?
হ্যাঁ, সেটা কাপে তো দিয়েছি আমি।
স্যার একবার বেরিয়ে গিয়ে আরেকবার জানতে
right go out and do it again. Right, do it again.
Also national conference on research development of chemical research being implemented in biology and medicine.
এটা কোথা থেকে আসছে? এই সাউন্ডটা কে করেছে? অন করেছে কি?
It is my opportunity to inform all of you that
এটা সাউন্ডটা কে ইউটিউবে কে তুলেছে?
Is it okay right now?
Department of Biotechnology, Government of India.
Dr. Pathak or Dr. Samanta, is it all right?
Yeah, can you go to the full screen now?
Yes, I mean, it is in the full screen mode.
Okay, you change the slide, then we'll understand what's going on.
I wish to convey my
Tagging chain is basically the terminal amino acid.
Maybe I do not know. Maybe that is. I mean, now it is all right. I mean, I can see this is full screen.
Don't use that one on the top. Go to the bottom.
Yes, bottom. I mean, that's what I am doing it.
There are three symbols. You go to the third one. You have clicked on the first one, which is looking yellow. Go to the third one, which is showing a screen.
So video
near that 100%, that screen.
Yes, that I have done it already. Maybe there is some problem. Maybe the live. Is it okay? Or otherwise I will go with it. I mean, I do not know what's wrong. Maybe I see.
Are you going to presentation mode?
Yes, presentation I am sharing. Then I'm presenting.
First share mode.
Yes, share. I shared already.
Then go to sir. Go to slideshow. উপরে দেখুন স্যার slideshow তে গিয়ে আপনি from beginning. Yes, it is.
Then share screen.
Share screen.
Okay.
দিয়ে প্রেজেন্টেশন পাওয়ার পয়েন্টটাই করুন স্যার, ক্লিক করুন আপনার যে পাওয়ার পয়েন্টটা খোলা আছে।
PowerPoint share.
হ্যাঁ, এবার এখানে দেখুন পাওয়ার পয়েন্টের যে ফাইলটা আপনি দেখছেন ওই ফাইলটাই দেখুন উপরে স্লাইড শো আছে, ওইখানে যান আরেকটু উপরে মেনু বারে স্যার, মেনু বারে উপরে আর এর উপরে
আরো উপরে যান স্লাইড শো।
হ্যাঁ, এখানটা ক্লিক করুন স্যার, ওইটাই ক্লিক করুন স্যার।
রিজিউম স্লাইড শো। হ্যাঁ, এবারে কি ঠিক আছে?
রিজিউম কেন দেখাবে স্যার? ওটা তো ফ্রম বিগিনিং দেখাবে।
ওই নিচের সিম্বল একটা কিছু করতে হবে, কারণ এই বাঁ দিকের কলামে ওটা দেখার কথা নয় আমাদের।
এক মিনিট, আমি এটাতে এইখানেই এটাতে করে দিই।
আচ্ছা, শেয়ার করার আগে করে দিন তো স্যার।
ও, এটাতে নেবে না। ও, এটা তো নিচ্ছে। এবার ঠিক আছে? ও, মেবি like go with it right now.
না
আচ্ছা, okay, so I will go with it. Maybe it is a small screen, I do not know, maybe it is
সেকেন্ড স্লাইডে যান তো,
সেকেন্ড স্লাইড, থার্ড স্লাইড আমি যাচ্ছি।
নো, স্লাইড ভিউ তো হচ্ছে না স্যার, ভিউ তো ফার্স্ট স্লাইডে দেখাচ্ছে এখানে।
ও আচ্ছা,
হ্যাঁ, এবার আসছে। হ্যাঁ, এসছে এবার
আমি এই মোডেই দেখাচ্ছি।
হ্যাঁ, ঠিক আছে,
ওকে। ওকে, আউটলাইন। হ্যাঁ,
আমরা পুরোটা দেখতে পাচ্ছি কি স্লাইড?
না, ওই টানলে দেখতে পাচ্ছি।
আচ্ছা, ঠিক আছে, গো অ্যাহেড প্লিজ।
Okay. So outline, I would be talking about some of the healthcare material, mostly in terms of the drug delivery and implants, and then I will come to the translational research that we are doing with the help of the BHU hospitals. So keyword of this talk basically the healthcare and the biomaterials, and we talk about some of the drug delivery, and basically we talk about the materials used in the drug delivery. There are different types of material, chemistry wise, inorganic and organic materials that we do use for this delivery vehicle. So let me first talk about the role of chemistry and the role of chemistry for healthcare material. So there are different types of molecules, the drug molecules. Some of the drugs are small, some of the drugs are large molecules. So like here we are talking about the different drug molecules, like Professor Bosak has told so many the drug molecules. Here, I mean, one I mentioned a very small drug, which is a arthritis drug, and insulin drugs for diabetes, which is a very large molecules. And the other things that we can embed, or we should embed this drug. Later, I am coming in why we should embed it in some of the vehicles in order to deliver them into cells. there are the polymers are being used. And polymers are formed through some chemical reactions. We start with monomer, and then it comes with dimer and oligomer, and then very large chain from single molecules of monomer like ethylene to polyethylenes that we derive at various degree of polymerizations, which give us the small molecule to large molecule. And these materials are being used as this carrier of the drug. So I'm coming to the why we need these carriers and so on. There are two types of the carriers: inorganic, organic, and these metals. All three types of materials are being used. I will be mostly talking about organic and inorganic one. And here, inorganic one, there are different shape and size of the inorganic materials like CNT, graphenes, and so on. And one can do some chemistry alloys on top of CNTs or graphenes in order to use them as this drug delivery vehicle, or we can tag this drug with these two materials and so on. There are another type of inorganic one, which is inorganic materials, which is known as the layered double hydroxides. It's basically a sheet kind of structures, and they are layered. They are stacked together through these van der Waals forces, and there are certain spaces between the two consecutive layers. And I mean, here there is a chance that these blue particle, which is shown here, so that is a replaceable anions, or sometimes it is cations, depending on the chemistry used. So one can replace these things with the drug. We can hide this drug in between the layered structures, and then we inject it in blood streams or the muscles and other things, so where they will deliver a drug gradually. That's the important aspects, that here not all in a sudden the drug will be coming out. Slowly they will be coming out. And and then so these are the inorganic one. And if we move to the metal one, so like silver, gold, and the noble metals are used for the drug delivery, and one can do the chemistry of thiol chemistry, and there are different kind of chemistry afterwards which eventually will be used as a drug carrier, and which will carry the drugs. And then there are different kinds of treatments, even in chemotherapy or radiotherapies and so on, or phototherapy. One can do it by putting this kind of material into a particular or affected areas of our body. So the inorganic one, and then the metals, and then there are a lot of polymers being used. Mostly polymers are used as this drug delivery. Okay, so there are, let us talk about some of the polymer molecules. I told it that through covalent bonding, monomer can be dimer, trimer, tetramer.
আপনার স্লাইডটা কিন্তু আসছে না স্যার, স্লাইডটা স্লাইড চেঞ্জ করছেন আপনি স্যার?
হ্যাঁ,
ওই সেকেন্ড স্লাইড বা থার্ড স্লাইড আসছে না স্যার।
ও কেন বলো তো প্রবলেম? এই দীপেশ আচ্ছা
শুনুন, হ্যালো,
আচ্ছা হ্যাঁ দীপেশ।
That's right. I was also not seeing.
Oh, sorry. I mean, দীপেশ দেখো তো এখানে কেন এটা যাচ্ছে না? আমি
মোরের স্যার হাইড করা অপশন
কোনটা বলো তো?
Dipesh, I don't know you, but Dipesh, listen, it's not in a slideshow mode. Okay, so please take it to the slideshow mode, otherwise it will not move. You restart it.
I mean, is it visible?
Yeah, it is visible, but it's not in the slideshow mode, and its slides are not moving.
Slides are not moving. So screen ta share korte hobe puroটা.
Yeah, exactly, but I don't know whether he has done it rightly. Check it out, please.
এটা থেকে বেরিয়ে যায়, হ্যাঁ?
হ্যাঁ স্যার,
এটা থেকে বেরিয়ে যায়?
Yeah, you get out. Yeah, sure. and then you do it again.
No. এইখান থেকে আমি
নতুন করে শেয়ার করুন।
হ্যাঁ, নতুন করে না এইটা করি। এই তো বেরিয়ে গেছি ওখান থেকে।
হ্যাঁ, পিপিটি
এইটাও করেছি।
হ্যাঁ, ফুল স্ক্রিন করে নেন
এটা ফুল স্ক্রিন করে দেবো।
হ্যাঁ, এবার ওইখানে যান, ওই ভিডিও, ওই হ্যাঁ, এবার এখানে
স্লাইড স্ক্রিন না, সেটাই তো করলাম।
এইখানে
এইটা
ফুল স্ক্রিন করুন, এটা
কোনটা?
এই স্ক্রিনটা শেয়ার করুন। হ্যাঁ, এবার এটাকে শেয়ার করে দেন।
ও এইটা,
হ্যাঁ, এবার দেখতে পাবে।
আমি
Yes, visible. Yes, clearly visible.
Yes. Thanks to Dipesh.
Right.
Yeah. So you can see one of those arrows probably. Dipesh, change the slide if you can. Yeah.
Yes.
It's working. Yes.
Okay. Okay. Now you can see this slide.
Yes, absolutely.
Yes.
Thank you.
Please.
Oh,
go ahead.
thanks, Dipesh.
Thanks, Dipesh. Yes.
Okay. So what I wanted to show you that there are different size of the drug molecules, a small one and bigger one, and there are examples. And then we have different kinds of vehicles, starting with inorganic one. So these are the CNT or the graphene or the layered double hydroxides, and then this belongs to the inorganic one. And then there are metals, noble metals like gold or the silvers and other noble materials. They can be used using the thiol chemistries. And then one can do the lots of chemistry attached to this thiol group and can be acting as a drug delivery vehicles. So I mostly focus with the polymeric vehicles. Polymers are the different types. One is the linear polymers, and one can do some chemistry like the graftings and attaching up several other groups with these polymers, whose density can be varied and whose size of these chains can be varied as well. And so this is the linear polymer, which can be modified through the graft chemistry. And another one is there is a block of polymer, like it has one block and say hydrophilic and hydrophobic block. So a block has that capacity of attaching two very different types of drug molecules all together in a single molecules. And there are other copolymers like random copolymer, AB, and so on. So they can be used also, and through changing the chemistry of the monomer A and B, maybe one is hydrophilic, another is hydrophobic, and they can be attached together and they can form a combination of monomers which can capture or embed the drug molecules for its delivery. And there are different other the architectures like the cyclic structures, and which can be also grafted further. So there is another architecture. The next architecture is different generation of the molecules. So this is the first generation, second generation, and third generations. So we can have a very complex structures, and then the advantage is if we make these the complex structures, we can hide the organic any other biologically active molecules in the space between or within the single molecules. So that has this advantage of the different generations of the molecules. And there are another kind of things which are intercalated one, similar to these ones. I say here the nanoparticles of say different dimensions. So they can be attached to it through sometimes with covalent bonding, sometimes with secondary forces, or hydrogen bondings and so on, connect with the another molecules. Sometimes it is drug molecules. So they can be all together acting as a vehicles which can be injected into the bloodstream, which show the disease control and other things. I mean, here I'm just a summarize of these things, that what different kinds of materials can be. So this is one of our cover page in this language, that we are different the dimensions of the molecules, starting from 0 dimensions, 1 dimensions, 2 dimensions, and if it is either it can be a small molecule or a large molecule, their structures can be like this, which is known as the 10 dimer. Sometimes they can be hydrogels. Sometimes the drugs can be embedded in the polymer as a complex molecule. And there are some mesoporous material where through these pores, some of the drugs can come out and acting as a very good vehicle. And the micelles also, there is formations of beyond a certain concentration, the molecules which have a head and tail part, so they can form a micelle kind of structures. And at the core of this micelle can hold the drugs, and they can be acting as a vehicles also. And similarly, and if it is a layered patterns, but this is rounded in shape, which we call it as the liposome, so they can be act as a drug delivery vehicles. And the process is simple, that in any of these way, what we can embed the drug, and the drugs can be entered into the cells through the endocytosis, and there are different mechanisms through which these molecules will go inside the cells, and the whatever the drugs are there, so they will be released slowly to the cells, and they will kill the cells, and through the different mechanism that in the morning Professor Bosak has described a lot about the how the molecules act as a drug inside the cells, and the different mechanism by which it can kill the cells or the different the microbes. Let me just first give an introductions that why we need a controlled delivery. And as you know that if we take any medicines, it goes to our stomach fast, and immediately they will be exposed, say all in a sudden or suddenly, or within very less time, within half an hour, all the drugs are consumed by our stomach. And say all, if we take 500 mgs of antibiotics, all 500 mgs will be pushed into this bloodstream, and then this suddenly the concentrations of the drug will enhance, and there is a limit of every drug. If it crosses that concentration, it becomes toxic, and if it is below a certain concentration, so it doesn't have any disease control effect. So it should be within these two concentrations, and then only this drug is effective. And most of the conventional drug flows these kinetics. But if the concentration of the drug does not remain say within this range and for a very long time, it will not be affected. So for this reason, in order to release the drug at a slow rate, we need a vehicle. That's the necessity of a vehicle. Most of the drug, and nowadays there are few drugs. I mean, I think when we were kids, and the eye drops, we used to put it 4 to 6 times a day. But now, we know that eye drops at least say once in a day. And the reason is throughout the day, the systems will deliver the drugs slowly in the eye. So that's the necessity of not putting the drugs for many times, but in single dose that can serve the purpose without affecting this part. That once it is say 500 mgs of antibiotic we take, and immediately we should have a toxic range or which will affect us. And that's the reason after taking a few days of high dose of antibiotic, we have problems several problems starting from say indigestions, and sometimes people feel nausea, and because of this toxic effect. But the same drug, same 200 mg, if we put it in a vehicle, which will release the drug at a slow speed, and then we are safe, and it will kill the disease, or it will control the disease. So in order to do that, and then we have several ways of doing that. I just mentioned in few slides, and there are another ways of either we can do the functionalizations of polymer, we can embed some part in these polymers, or we can degrade the polymers, biodegradations, and then the chopped molecule will degrade the molecules. The chopped molecules will release the drug slowly, and sometimes we put the different kinds of nanoparticle here, and in presence of this nanoparticle, the drug release will be slowed down. And then if we put different size of the particle, they will also drag at a different speed. These are the various ways through which works are discussed. And then gradually we will do the one by one of using these different concepts. Okay. So this is the please mute your mic. I think there is some noise. Okay. This is okay. So this is one example of using biodegradable polymers used as vehicles. So this is the demonstration that with time your molecules degrades, and then the drug will be released from these systems gradually, and then we have shown it through SEMs and other things. The weight loss of this from this image is like this. What is important is that if we put some of the nanoparticle here, we can control the weight loss rate, and then we can increase the rate of say drug release, or we can decrease the drug. And that's the effectiveness of slow release by using a biodegradable polymer. So this part here we have shown it. So if we do the different nanoparticles, so 15A and 30B is two different nanoparticles. If we use that in same polymer, PHBV, polyhydroxybutyrate and valerate, it's a copolymer. And then in one clay, it enhances the biodegradation, but other clay, it reduces the biodegradation. So here, a release will be very slow, that we have shown it here. The release will be very slow, and here the release will be fast. So that part we can do it here, that cumulative release of the will be high here and low here. So using two different nanoparticles. And then we try to understand, I am not going to inside of this. It's basically the phenomena by which we can change the enzymes, microstructures by changing the chemical environment like pH and other things. So pH, suitable pH, which can bind the polymers and the enzymes perfectly, and then followed by the chopping of these molecules. I mean, then your degradations will be controlled, and followed by the release of drugs accordingly. And okay, I will skip this part, and then I will go to the some chemistry part, and here is the simple reactions of diisocyanate and diol. It's basically a rearrangement reactions, and then this is NaCO, kind of a condensation reactions. Also, it is modified condensation reactions, where there will be no elimination of small molecules as compared to the conventional condensation reactions. And then this NaCO is available with reacting with another diol, and subsequently we have a linear change. And then we can have a long chain molecules, But sometimes we use these cytosans as the subsequent chain extender, and then we can have a copolymer, or sometimes known as the graft copolymer. Schematically, it is shown it here. So we have a hydrophilic the polymer. We can have a graft polymers using these cytosans as the chain extender, and then we can have this kind of microstructures. So these are very important. I mean, here the number density we can check, or the length of these the molecules that we can also control. So by that we will be able to form a hydrogel of this. Hydrogel, we can see it here as a, we can have a, we start with the hydrophilic one. So hydrophilic is extremely difficult to control because it's very strongly hydrophilic. And but if we make it hydrophilic hydrophobic balance through connecting a hydrophobic part here, so then it is having a balance, and so that will control the gelation kinetics. So we will be able to make it salt to gel transition as after 5 minutes or 10 minutes, depending on the chemistry we do. And why it is required, say suppose we need to do it a injectable hydrogel. So at least 5 minutes it should be in the sol state, and while we will be injecting the sol, it will go inside the animal or the human being, and then after 5 minutes it will be converted into a gel, which is a semi-solid, and it will not move from that part of the body to the other parts of the body. And then it will have a localized effect, like the cancer, tumors, and other things that I will be showing you, that it will be releasing the drug only at that particular spot or at particular locations. So that's what the sol gel kinetics are important. And it is just the a kind of a the morphology of the gels. Here it is a lot of space where we can hide different biologically active molecules, including drugs and other things, and it has sufficient mechanical strength. We can measure through the compressive strength and so on. And then we see how it is important here. If we inject the sol here in the animal, and then after 5 minutes it will transform into gel here, and next day if we open it, and then we can see that gel is only at these positions. So otherwise, if we put the solution, it will remain in the solution phase. It will be spread across the body of the animal. So that's the advantage of the injectable hydrogel. And these things are possible only through the hydrophilic hydrophobic balance of these molecules through this grafting. And here we have seen it that how they will release the drug at a very different kinetics. That's another aspect. And another part is the gel will injecting the drug at same locations only. At only at particular locations.
Mr. Sheikh, Munirul Sheikh, please mute your sound.
Okay, there is another the controlled release of drug. This is a two-dimensional layered double hydroxides, and there are some replaceable anions, and raloxifene, which is the anti-cancer drug, which is also negatively charged. So this can replace the negative ions present within these layers. So they are typically nitrate, carbonate, or phosphates. Carbonate and phosphate. So they will be replaced with the drug. And now we have a drug molecules within these layers. And the advantage is, as they are within the layer, so they will be released at a very slow, or they will be released at very long time, after a long time. Or in other words, we can change the kinetics of this release from fast release to the slow release, and this will be affected too much in case of the disease control. We created artificially the breast tumor in the animal, And then we put our these systems where the anti-cancer drug is embedded or hide in within these layers. Then you can see that we have done it in cell culture as well as using animal models. We see it in the cells. If it is pure drug, they cannot kill the cells in large number. The reason is the drug is negatively charged and our cell is negatively charged, so they are repelled electrostatically, so very less drug can go inside the bloodstream, inside the cells. That's the main reason that the anti-cancer drug, whatever we take for during chemotherapy, most of the drugs are secreted through the body, through the secretive systems, not going inside the cells. That is the biggest problem. And on the other hand, if it hides it in a two-dimensional layer, and then the whole thing is positively charged as measured from its zeta potential and other things, and then positively charged species can go inside the cells, and we can see there are huge killing. The red and yellow, yellow is the apoptotic cell which has started to get killed, and the green one is the live cells. Here, live cells are very less. These systems can effectively kill the cells. This drug, though the drug is same and same concentration, they are not so effective to kill the cells. And if we see it in the mouse model, and if they put it within the mouse, there is huge weight loss of the mouse. And we say exercise this liver and see the morphology of the liver gets damaged. And if we inject this one, our modified systems where there will be slow release, so they follow these kinetics, and then the size of the morphology of the liver is normal, and it is also visualized from the no weight loss of the animals. No weight loss means, the animals are healthy. As you know, that during chemotherapy, the patients lose their weight, hair loss, and appetite loss. So all these three things are caused by mostly the damaging of different other cells other than the tumor cells by the anti-cancer drugs. So what immediately, the liver is the most sensitive organs of our body, which is easily damaged by the many drugs. But here we can see the normal drugs using this kind of the drug delivery vehicles. And similar concept, we put it here, we further extended it. We put the drug within these layered silicates, double layered material, or it is called as the LDH, layered double hydroxides, and then we further wrap it up using the polymer. The advantage is here we drastically slow down the release rate of the drug by these methods, by wrapping up of this material using the polymer. And this kinetics is helpful. If we put into this system, we put this or inject this material into the animal, and you see how the drugs are being there in the bloodstream that we have measured. And this is the systems here. So 100 hours means it's around 4 days. So 4 days, the drugs are there. The conventional drugs are only for 12 hours or so. So this is the advantage of this one. So our controlled drug delivery can deliver drugs for long 4 days, as opposed to the only 10-12 hours of delivery. And here the rate is actually extremely high. Most often they cross the toxicity limit, and that's what most chemotherapeutic patients undergo nausea and the loss of appetite because of this reason. And in this case, we do not go, maximum limit is this, and we are not going beyond these concentrations. And that's what, the chances of nausea or weight loss is extremely low, and it is slow release will effectively kill for all 4 days when we will have another second dose of chemotherapy. And then this concept we have proven it through the morphologically how the cells are exhibiting and so on, through models and other things. So I'm not going details of this one. Similar, the other part that we have put it in the wound healing applications. This is a common drug, ciprofloxacins, as the wound healing the medicines, and we put the PEG, which controls basically the rate, and here the rate is very fast. If we put the PEG and the rate is fast, and then wound healing, the first release would be helpful because only 19 days is this experiment day, while in the cancer, often a few months is the chemotherapeutic range or chemotherapeutic time range. And here we have seen it, if it is very slow and then it is getting cured in 40 days, and whether in a fast release and it's cured less than 9 days. So that's the effectiveness of a slow and fast release or controlled release of drug. Not always that, we need to have slow release. Sometimes fast release is also important, like the wound healings and so on. Okay, and here is the another the concept of putting these drugs within this gallery. But here, what we did, that in addition to the drug, we put some of the cases that the monomer which can polymer within this one. So the drugs will be here embedded by the polymer within the gallery. That's these important aspects. And one can do a lot of chemistry or physical chemistry by changing the different their space and so on. And subsequent polymerizations can lead to a exfoliated structures and so on. But all these things are important to control the rate of release of drug from these systems. So these are the different architectures that we make. They are useful to control the release rate of drug at a very differential rate. That's the aspects that we use it in the drug delivery concept by altering the microstructures of the polymer in presence of the nanoparticles. And then here it is kind of a the physical chemistry, and there are different probes. You know that optical microscope which can observe in the micron scale, FM in the micron scale, and neutron scattering. This is SANS is small angle neutron scattering, which can get the tens of nanometer of the particle, and XRD, which can basically the 001 spacings, which in the nanometer level dimensions. So there are all kinds of the probe which eventually tell you the different type of clusterings because of the self-assembly phenomena. And self-assembly is because of the intermolecular hydrogen bonding between the either between the polymer or polymer drugs. And then through these probes, we will be able to get different kinds of assembly starting from nanometer to the micron size. And here we have shown it schematically how the changes of the size that we can get it from the neutron scattering and so on. And sometimes here we can embed very small inhomogeneities, and as opposed to the big inhomogeneities, here diffusion would be slow, diffusion would be very fast. And in this case, in addition to the polymer, we put nanoparticles, and which will create additional inhibitor, which will slow down further of this drug release. By that way, all three different systems, they will control the drug release rate very differential manner, very high and very slow. This will be used for by using the different architecture. These we will be able to cumulative percentage release. And then I'll show you that the different the architectures like clodextrin is this molecule, and then we do the chemistry of crafting using polyurethanes and so on through this chemistry, and we will be able to do the cumulative release very fast rate. That is the conventional drug that most often it is the cyclodextrins are there in most of the pills that we to take. So immediately within a few hours they release the whole drug. But if we use this system, so they will be released the whole drug maybe in 2 or 3 days. So that's this interesting that maybe one dose of drug is enough for 2 or 3 days consecutively. And then we see this effect on the animals. Sometimes we are a bit cruel and we generate tumors in animal, but the purpose is nice that we heal the tumors also. And here we have seen it that how the healing takes place in presence of the controlled release systems, and our improved delivery actually keep the liver of the animal normal as opposed to the highly affected liver if we use the pure drugs. This is the advantage. And we have a kinetics here. We measured the what is the tumor size as a function of time, and we see the melanoma. This is a the skin cancer, and that is called the melanoma. And melanoma, if it is a normal or we control, means without treating, the size is getting higher and higher. And this is a system so where we can retain only the initial size almost. But this is a systems. I mean, if we design the polymers in this manner, where the drug can be embedded nicely, and then we have a healing of these tumors as well. And here we don't see the healing, and these systems inhibit the further growth. But in these systems, through these different generations, so this is a little bit difficult to obtain it. I mean, one can do it by tagging something and then open it, and then followed by functionalizations and so on. And but if we generate this kind of architecture, so they will release it very gradually, and they are holding capacity of a larger amount of drug. They are very nice of killing the drugs, healing the whole tumors. Almost it is going to the 0 level. And so that's the effectiveness of slow release of the drug. And we have another systems. I mean, we have a linear polymer, and then we do have the grafting at a different length scale, different density. And by doing that, we will be able to do a very fast release to a very slow release. And the same thing we have done it in these say melanoma or skin cancer. We see it that okay, so the controlled, there is a huge expansion of the tumor, but our delivery systems are good delivery systems. This has reduced to almost 0. I mean, this black part is because of the melanin, but the tumor size is here almost 0. That's the but this is the black part is because of the melanin. Melanin, I think you see that melanin, most of the foreigners are coming into this Goa, that they are the skins are blacks and so on. This is because of the UVs and other radiations cause that melanins and so on. But here we induced this melanoma. This because of the inductions, the black colors appears, but there is no absolute tumor after 30 days. So that is, we obtain it from this kinetics. The size of the tumor, it is going down, and as opposed to the normal size without control. Then here there is another systems where we deliver genetic material like DNA, RNA, and so on. We put these DNA or RNA within this gallery, and then we can release it within the cells, and then this DNA will be useful for disease control, like gene repairing or killing up cells and so on, or cell killing cells and so on. So here there is kinetics again. So these kinetics are very important, that at what rate so this material is effective, which will release the biologically active molecules at a different time scale. Okay, so this is the things, and then DNA or any genetic material can be delivered to the cells, and we have shown it through the morphologies and other things. I'm not going into these details. That this DNA, the whole thing will be going inside the cells, and there will be no a barrier, because this is positively charged, and will go to the cells which is negatively charged nicely, and then this part will be hydrolyzed within the cells, because especially the cancerous cells are slightly acidic, and in the acidic medium they will dissolve out, and you can get only this DNA available for disease control. And now I'll talk about something that's just a very brief. In the we have some activity of implants. I mean, there's implants are being used when there is the fracture of the bone. So this is a normal bone. If there is a fracture here, and doctors put a metallic implant. So this is the metallic implants, which can hold the two different broken parts. Now there is a huge frictions between the bone and the metallic implants. So the doctor conventionally use some of the grouting material, and grouting material is the bone cement, which is basically the polymethyl methacrylate. And this same polymer is being used as the glass, window glass. I mean, you know that it is almost 95% transparency. Same polymer is used here. Now, the bone cement or the pure polymer has some disadvantage. And as you know now, after say 1 or 2 years, so doctors need to remove the metallic implants. The reason is, after 2 years, so this material generally fails, because it's a brittle polymer, and it fails if we have a number of gait cycles. Gait cycles are basically nothing but how much we are walking or running and so on. Depending on that, there will be failure in this material. So what we did is to put some nanoparticle here, and then we see the mechanical strength, it is increasing. And this is the experiment, is called this MTS. We apply some frequency here, and we see this implant. So implants is actually this one. This is the we got it from these hospitals, and actually the animal bones, and we put the implants here. This is artificial implants, and we see how stable it is using these applications of this frequency in these systems. And then we measure it, and this is this result. The number of cycles in these composite systems, they put some nanoparticle, is enormously large as compared to the present system, conventional systems. So, and then one can expect what is the advantage. I mean, maybe instead of 1 or 2 years, one can keep the implants within the bone or within the body for maybe 10, 15 years or even higher than that. And this energy is actually very high in order to, usually our gait cycles when we jog, so this gamma, the force that we are applying here, the stress is around less than 2, 1.8 or 1.9. So we did purposefully, I mean, almost double the stress to see this effect. But that works very nicely. And then we try to understand what the role of nanoparticles and so on. And then it's basically morphological driven, and it's stop the catastrophic failure of the brittle polymer. And I will skip this one. And this is the effect that the one Indian-based nanoparticle that we found, which is available in Rajasthan. And then we surface treat it. and then we put it into the polymer and you see it. So they are very much effective towards the bone healing. This is a bone healing experiment, and a control takes around 90 days. And now this is the current system the doctors use. It's a heal around 60 days. But if we use a nanoparticle, it heals in 30 days time. So that's the advantages. And we are not going to the morphology and other things. We see that, okay, I mean, almost the control as compared to control 1/3, and with the present systems, it is almost the half time it can be healed. Then we try to understand that what are the reasons. So a lot of irons are there in these nanoparticles that is helping actually for a better healing. So this Rajasthan clay is consists of more iron, less magnesium. That is helpful for the bone healings experiments and so on. And then we have tried to understand that the bone infections and so on. So we artificially create the bone infections, and then in the control, there are a lot of infections because we infected it. But in the same infected systems, if we put a polymer particles where there is a drug embedded, and that shows gradual release here, and there will be no infections. So, or in other words, if there is a bone fracture, and if the doctor undergoes some surgery, and if we put something like this material, which will be biodegraded, so this biodegradable polymer, which will be biodegraded out through secreted systems, and there will be no healing during maybe 6 weeks is the typical time for our bone healing. So absolutely there will be no bone infection. Just we have seen it, that part one, this is a very tedious experiment. We have done it that, okay, in 20 days we have seen the polymers are still there, and 30 days polymers are still there, but at around 45 days, where the polymers get biodegraded or bioadsorbed within this body, and then there is no polymers, but the bones are healed and so on. And here just the small applications. I will not go into these details of these things. It's a development of a sutures or a stained materials. What we developed a shape memory polymers. It's based on the polyurethanes. Shape memory is explained at this one. We have the original shape. We curled it. We make into a spiral one. And at different temperature, if we put it 40 degree, where it is remembering its shape. So pure polymer, it's not 100%, but if it is a composite system in presence of this nanoparticle, so it's remember its shape, and it is, we are getting the almost opened up or this material remember its previous shape like these things. So the reverse things is also true. So if this is the original one, we stress it, and if we put it at the same again 40 degree, and then it is getting spiraled, and whether it will be working, let me check. No, it's not working. Okay. So this shape memory polymer, I mean, we try to understand that what is basically responsible for this, that the nanoparticles, movement of the nanoparticles from different zones of the polymers, which are responsible for the crystallizations and thereby the shape memory. But the applications are important, and during the stitching and other things, we created a cut mark in animal, and we sew it using our material of this, and then instead of stitching it, and we just warm it using a hair dryer at around 40 degree, and then automatically is squeezed. So this is a painless kind of stitch. So, and in 6 seconds, it appears. This is the one applications of this memory polymer. Similarly, so these things, another applications of same memory is the stained applications. The stained, we put this material here within a cylinder, or a tube basically. And now we put these things in a 40 degrees centigrade or 37 degrees centigrade water, and it is the shape of these things. And then it will be acting as a kind of a stained material because remember its previous shape. So through shape memory polymer, one can develop the stained material, and a self-eluting stain is this what I think you heard that Saurav Ganguly has gone through this surgery, that the self-eluting stain. Here this is a polymer, and then the polymer can be release the drug only at these locations, even if there is a kind of a tumors or other disease which can be controlled. Using this the material which can able to release the drug only at a particular location. That is the great advantage of this kind of stuff. So one small thing that I will be just finishing here. We have done it a lab to bed model. I mean, this is a 5 different, in Bengal it is called Bot, Sutto, and Domur and other things. All 5 the bark that we collect, and then it's called as the ponchobolcal. And this is a very old drug during Sustruto's time, and he used this drug for wound healing and so on. And what we did here, the doctors faced this problem of dispersing it in water. So our one improvement is we use some dispersant to disperse this in solution form. So doctors can apply direct the solutions. Another form is we electrospun it, and then we have a kind of a patch. So this patch is, if we put it under a microscope, and we see there are a lot of pores here. That's the advantage. As opposed to this film, there is no pores, but at the same magnifications. But here we see there are a lot of pores. That do the miracles here, and these pores are available to take out the pus from the actual wound site to the outside, and allow the oxygens to push into the wound sites. We have tested it in this animal model, so that these systems works much better. 11th day is the time where this cures, and in animal more than 14 days is the time requirement. Animal, the solutions and films, they take slightly longer time, but this is this best material which we got through the electrospinning and the scaffolds kind of material. And then we applied this material. When Professor Sahu was kind enough to do this experiment on behalf of us. And then this is actual the things on human being. The solution tested, and then stable solutions, and it cures 57 days. It's a very long time. And the reason is the size and the nature of the wound. The wounds are more than 6 inches. And here there is scaffolds. I mean, the size of the scaffolds are, nearly 6 inches. You see the nature of the wounds. But still, in around 56 days or so, it's completely healed. And the patients who used to come to the BHU hospitals, and they could not heal these wounds using other means and so on. So that's what they approached Professor Sahu, who is a anorectal specialist basically, and along with the wound healing specialist. So he used that materials, and we have done these clinical studies in Sri Ravi Shankar's hospital at Bangalore, and other one is now currently undergoing at Rishikesh in some Ayurveda hospitals. Okay, to be brief, through this chemistry we can develop different kinds of materials from solutions, films, scaffolds, or some kinds of your the implants material, stained, and some Ayurvedic material or modified material, and then gels and so on. And through this one, I will just conclude it. Okay, so this is just some of our the highlights in different the. Okay, I would like to mention this Professor Manoranjan Sahu, who is the anorectal specialist at BHU, and then who did all the Ayurvedic work, and Professor Sam Sarap, who did all the orthopedic work in animal model and in one cases on patient, and Mohan Kumar, who helped us in histology, and Professor D. Das did the biocompatibility for us, and currently we're doing with Amrita Kaur histology, and Dr. Manori is the another doctors in Ayurveda, and my students, some postdocs and my PhD students, so they are skillful of doing cell cultures and animal model studies, and who are at mostly abroad. So I think let me conclude by this way that suitable vehicles chemistry which improves the quality of life. So that's the conclusion that what we were able to demonstrate this one. Okay, and thank you for listening me. Okay.
Thank you, Professor. Thank you, Professor Maiti. Wonderful talk to see the application of chemistry directly. Even it's not only on the rats, he ended up with human beings also. So how far it can be stretched really, the application of chemistry. So it's now open for discussion. Please ask questions.
Hello.
Yeah, go on.
Good evening. Yeah, good evening, sir. So myself Gangadhar Singh, and I'm first year student. So, sir, I have a question about we are doing experiment like on animals, and the same thing if we get like a success that research, so we like apply the same thing on human being. So is it correct, sir? Because human body has something like different from the animals. So is it correct? I just want to know about your concept and all.
Yes, I mean, who are you? Maybe I can have your name?
He's Gagandeep Singh.
Gagan, okay. Gagan, very interesting. I mean, you know that, I mean, there are, say, any drug is discovered. I mean, initially it is tested on cell first. Na? I mean, whether it can kill the cell. Second step is whether it is applicable to animal. Na? And animal, there are different kinds of animal. I mean, first it is applied to rat, mice, and then rat, and then bigger animal like pig, you know? And then sometimes monkey, and then it is applied to human being. So once it is tested that, okay, say, I mean, it is very suitable for monkey and say chimpanzees and other, and then we are the monkeys and chimpanzees are very close to the human being, and one can be knowing that, okay, it can be applied. So that's the idea, and before doing that, one has to go with all the cell culture, animal model, and then proximity to the humanoids or the human the things like chimpanzee and or monkeys, and then it is applied to human being. And in our case, it was actually rather used. The drug, we did not have the ethical permissions. I mean, we have the ethical permissions of embedding this drug into the systems. So otherwise, this Panchavalkal was used long back. I mean, it's a traditional medicines. So that, I mean, for medicines, we did not have any extra effort. We put this effort, and Professor Sau had taken the ethical permissions from the institute of applying of this new device. We call it as this patch. So that part, that is the ethical, there are ethical committees, mostly headed by doctors and some representative from the Indian government. So they do it, and we just prepared it and hand over to him. And so they have done the entire case. I mean, we are not supposed to do it of our own.
If I may add one or two words, Gagandeep, The point is that if it is a new synthetic molecule, then it needs to go through a very critical trial. Okay, even after getting the permission, it has phase 1, phase 2, phase 3. Maybe I'll show you one slide tomorrow when I give my presentation. But for these Ayurvedic drugs, apparently, if it is a whole extract, then there is a permission, different kind of permission that is required, which is not as rigid as a new synthetic molecule. And I think it's also for external application, I believe, Professor Maiti.
Yes, it is mostly external. Mostly external, but
Mostly.
actually it's not harmful for internal as well.
Okay.
Because I mean it is being used since very long time, and no problem. All the trees are actually very important. Which board, asutta, and dambu, and so on. These are that in Bengal we have the different.
Actually, you know what? After my MSc, I worked in a company for a while, drug company. There was a company called Organon, and Organon was working on this traditional plant medicine and so on. And that time, we had to read this English translation of Sushruta book, and it's a huge book and all that. It seems there is an issue that if it is mentioned in Sushruta, then you can work with it without much hassle. So that some such permission is around. And we used to have this gentleman, he had 5 volumes books, Chiranjeev Bonaushadhi, published by Ananda Publishers, Shivkali Bhattacharya, Ayurvedacharya. So he used to come as our advisor. So we didn't have any problem to do any animal model experiment because it was an Ayurvedic drug. Okay. Anyone else?
Yes, sir, thank you so much, sir.
Okay. Anyone else? Please ask questions. This is your best time to know something from experts. I have a question.
Please.
I always have this argument with Divakar when his students give any presentation here and so on. See that when you have a vehicle for drug delivery, many a times the material used for the drug delivery is a synthetic material. It is not necessarily biodegradable. So for each molecule of the drug, you have a huge amount of a polymer accumulating into the system. How do you see this problem?
This is not a problem at all. Let me tell, most of the materials I use, they are polyurethanes and polyesters and LDH. So whenever they go inside the cell, so it is slightly acidic, and in that conditions they degrade. So because it's either it is a ester linkage or there is a urethane linkage. These linkages are susceptible towards hydrolysis. So with time, it will go. Maybe it may take maybe 1 month or couple of months. I've been in cases, but absolutely no problem. They are not actually somewhere sitting in the cells. So they are being excreted like LDH. All these your aluminium, oxygens, linkages, they are broken at pH 6 or 6.5. So that's always the case for the cells. So they are getting fragmented, even if it is a 100 nanometer wide, thick. So, but they are fragmented and then getting excreted using that normal excretory mechanism.
And the second question is that these nanomaterials that you are talking about. What about the toxicity of nanomaterial? This must be very different from the toxicity of ordinary compounds that we know.
In this case, say whatever in our case, they are non-toxic. Say we have done this cytotoxicity and other things with cells and so on, and they are absolutely fine and no problem. And toxicity that is tested. Before actually applying it to animal model, we have to thoroughly gone through this toxicity study on cell. So that will tell the how say toxic it is at a different concentration level, different conditions, and so on. But they are,
Non-toxic.
non-toxic.
Okay, thank you.
Actually, yes, LDH and clay or the polymers. Polymers, most of the polymers are say including PU or PLA. So they are FDA approved polymers. So and nanoparticles also. I mean, they are not approved by FDA, but they are highly biocompatible.
Okay, all right. Thank you. Anyone else want to ask any question?
Sir, I have one more question, sir. Sorry,
Yeah,
sir, I'm
please,
just
please,
telling you.
please.
Please feel free to ask. Huh?
Yeah.
Okay, sir. So, sir, I'm just asking, sir. So, the toxicity levels, sir, difference between human and animals. Okay. So, if, sir, something we are trying in animals, so we are putting something like, suppose we are like testing the drugs. So we know the like toxicity level. So if we go above the toxicity level, so it become a toxic. Okay. So how we know that in the human body that much we will put, or that's a toxicity level, or maybe it's work or not work, because maybe yes, sir.
No, Gagandeep, I mean, I tell you in this very perspective of this corona, I mean, I think you know that Covaxin is not getting the permission still by the WHO. Right. And the reason, and there are not sufficient data. That's what the WHO asked for. Say, on the other hand, Covishield, it has been given to many other people globally, and the UK company, so they have studied on to humans also, and then I mean you are true. If it is true, if it is good for say cells and animal, that may not be good for humans also. So that's what clinical trial is important, and then there are phase 1, phase 2, phase 3 trial. So all these trials is important. I think Gagandeep, that maybe the just after the first wave, even the AIMS doctors were reluctant to take any of the Covishield dose also. There was a reluctancy by the doctors, and they had the notion ki, okay, it may or may not work and something, and because there was not sufficient data initially. But once the UK company and the Oxford University, they have sufficient data, and then everybody is convinced. Data means it has been given to different persons also. I mean, that's the clinical trial, right? That's the clinical trial. Now I think you have I mean, Bengal also, I mean, I think which hospital, I do not, I forget, just one hospital is testing it for the kids. It is a 12 to 18 years. So that it is given as the dose or vaccine, but it is still in the trial stage. So that's what, I mean, the government is not telling it is a vaccine, but it's basically a trial, clinical trial. So that has to be checked. I mean, that's the reason, I mean, people are skeptical about it, the vaccines of the COVID, because usual vaccine comes up after 10 years or so. But these things come in within 1 year or so. I mean, I think the scientists worked extremely hard. And there are maybe little less data, but because of the urgency, the government they took the decision to implement it, and that is the usual case. Now we are safe. Actually, we feel safe because of the vaccinations. Now that's true. I mean, okay. I mean, anything we are okay.
Gagandeep, I will add one point.
Yes, sir.
You know this disease called HIV. Okay, AIDS caused by HIV infection. You know that? You have heard about it. Now the point is the very first drug, azithromycin or AZT, was introduced in the market without much trial, even when they knew that it was toxic, because sometimes you will have to measure between the non-availability of a drug and the death rate of the patients. Okay, so if you just type AZT, go to Wikipedia, and you will read the paragraph on trial. Okay, there is some controversy on that. So from there you will see it's not a very easy thing to answer. Sometimes it's depending on the urgency, as Professor Maiti has mentioned regarding the vaccine. The same thing happened earlier 30 years back with azidothymine. Okay, and I can tell you one thing on a lighter note, you can ask your teachers to invite me sometime, because I teach medicinal chemistry at the MSc final year level. So I can give some talks on that also some other time, not now.
Sir, I have one query, simple
Tomorrow,
query.
tomorrow you can hear from Professor Pathak. Eh?
Yeah, I will talk a little bit different. Yeah, sure. Go on. Please,
Okay.
please.
Sir, I have a simple query. The results coming from biological studies in vitro, is it reliable or not? Because after vitro, in vitro study, we need in vivo study.
Yeah.
So the results only coming from in vitro, is it reliable or not?
No, absolutely
I will
reliable.
let him answer.
Okay.
Go on, please.
Absolutely reliable. And but the only thing is, the difference is, I mean, where you are applying. I mean, say this is, I mean, I should say something that maybe okay, maybe the one player is doing very well in his locality, and if that player maybe in Kharagpur some player is doing very nicely, or maybe Medinipur town, but if he comes to the Kolkata, and then he will face the others, and then his efficiency may be slightly different.
Yes.
So the environment that do change actually, but it is absolutely true. I mean, and it is there is no ambiguity that the effectiveness in vitro that can indicate something to the in vivo process. So that's the way actually people before going to in vivo, in vitro is a must. So that's the indicator. I mean, and then if it pass the in vitro, it may not be good for in vivo, may not be. So that one need to check again in vivo, okay, whether we are putting it in monomer and whether it is going okay. Even if it goes, I mean, it go along very nicely with the animal, that may not be very good for human being, but there is a good chance that it should work. But then we should have a trial. So that's the process. But all the process results are absolutely reliable. I mean, one need to check whether this is working here, and that same player is working in Midnapur and in Kolkata as well. But that may, I mean, the environment changes. In somewhere, I mean, people used to work with, with barefooted, and you have now a boot, and player may lose its efficiency with a sophisticated boot whenever he changes the environment, and then slightly affected. But that's what we need to check with a different environment also.
If I may just add to this, I don't know whether Professor Boschak mentioned it, don't remember it in his lecture. You see, before this antibiotic that he talked about came into the market, there was sulfonamides, which were used as antibiotics discovered by a German scientist. Okay. Before Fleming's compounds were marketed, this sulfonamide was the first antibiotic incorporated into the market. That's a fantastic story, though. I'm just leaving that behind. The problem was the molecule came from a dye stuff industry. It's a red dye. Now, there is a nitrogen, double bond nitrogen in that molecule, which used to act as a prodrug, which means the molecule itself is not a drug, but after it goes through some transformation, it becomes a drug. For such molecules, if you do in vitro analysis, especially with pure enzymes, then you may not see the activity. You know what happened for this fellow? His daughter cut herself, and in those days there was no injection, nothing much was available. So he injected his daughter directly with that molecule, and the daughter survived. He got Nobel Prize in 1939, 6 or something like that Hitler did not allow him to go to Sweden. Then after the war was over, then he went to Sweden to take his medicine. So there are molecules which is a prodrug, and if the in vitro test does not take care of that hydrolysis and other thing to generate the pharmacophore that Professor Boschak has mentioned several times, then you may not see the activity of the compound. So you'll have to be careful. But the data is definitely reliable, and it is definitely the first or second step of any biological analysis of any compound before you can go to a rat or other animals. Actually.
Okay. Thank you. Thank you.
I should not speak much today.
Okay. Okay. Thank you, sir.
Sir,
Okay.
one query, please.
Yes. Yes. Yes.
Please go
Please,
ahead.
Dr. Shashadhar.
Yeah, go on.
Sir, very nice representation. Sir, in case of penicillin antibiotic, it includes 4-member beta-lactam ring. When 4-member beta-lactam ring destroyed, the activity was also lost. But in case of several cases, open chain system also exhibit biological activities. Sir, my query, what is the reason behind it? Certain cyclic system only for 4-member, if 4-member is replaced by 5 or 6 or 3, the biological activity are not exhibited by it.
Yes, I think Dr. Shashadhar, Professor Boschak has shown it very nicely that why two things just or any single molecule act as a drug or not, because it should match with the structures of your disease controlling virus, bacteria or something. Nah? Mostly, Professor Boschak was asking about the bacteria.
Yes, sir. Yes, sir.
So, this is the different architectures of the bacteria that actually plays an important role, and based on that, the chemist design the molecules, suitable molecules. So sometimes a 4-member works, sometimes 5-member works, sometimes 6-member works. And then you need to check it that what is the best suitable. So this is kind of a lock and key model. Like the enzyme works and so on. If it fits nicely, and then it will be able to kill and cleavage the part and other things. So that's very important part. So that's what it is. We cannot generalize. Okay, 4-member is always good, 5-member is not so good, and 6-member is very bad. That is not the case, because you have several types of microbes which has chemicals, or say either maybe genetic material, or maybe the enzyme it creates, or maybe the hormone it creates. So their chemistry is very different, and based on that, one need to, chemist usually, that's what this a great work of the chemist, understanding the biology. You need to generate the chemicals for particular that things. So that's what people do. A lot of trial and errors are required. And nowadays, bioinformatics are there, and which theoretically predicts which kind of the molecules would be little bit better. And then from 1 lakh to you bring it down to maybe 1,000 or 100, and then with 100, you need to work on with these systems. Now that's the way how the whole system works. So the development of a drug, why it takes so long time. That's the reason. The chemists work so hard. Every day, 2-3 your experiment, and many chemicals.
Yeah.
So,
Dr. Shashadhar, if I may add to what
Yes, sir. Yes.
You see, what happens is that if you think about an enzyme, just like let's say a football, okay, which has a defined cavity. Now, this molecule can attach itself to certain molecules to do certain kind of reactions, transformations. Now, if you can think about a natural substrate, then you can make a mimic of that particular structure with certain variation. I will show you some slides tomorrow to show how it works. Now, in case of this beta-lactam, there to start with, there is a 4-membered ring, one carbon
Yes,
is
sir.
attached to a
Actually,
nitrogen,
strained member.
which is a very strained, but it will not work everywhere because of the fact that the molecule is mimicking some alanine-alanine bond, which is a natural substrate for beta-lactamase. And there is a serine hydroxyl group which comes in and attacks that carbonyl, which breaks that carbonyl nitrogen bond, and this molecule attaches itself permanently with that enzyme. These are called suicide inhibitors. They kill the
Yes, sir.
enzyme permanently. So they are called suicide inhibitors. So there are different kinds of inhibitors. Inhibitors are mostly designed by looking at the structure of the natural substrate or the reaction of that product. That's how it is designed.
Thank you, sir. Thank you very much, sir.
Okay, so if there are no more questions, let's thank Professor Maiti, not only for the good lecture and a fantastic lecture, but also the questions that his lecture eventually generated for a nice discussion. Now it's over to you, Bidan.
Yes, sir. Thank you. Thank you, sir, for conducting this session. And thank you also, Sir Professor Maiti, for delivering his lucid and nice talk in front of our participants. Thank you, sir. And one announcement for the participants. The sessions of this first day have been closed now, and the session of the second day will be opened as per the technical program schedule. Tomorrow, we will meet at 10 a.m. in this virtual platform, and there will be one invited lecture from Professor Pathak tomorrow first at 10:30 a.m. and then some oral presentation will be there. So participants are requested to join at 10 a.m. in this virtual platform. The link will be provided in the WhatsApp group. Thank you for your kind cooperation to join with us and to make this program a successful one. Thank you.
Thank you. Thank you.
Okay, thank you, Vidana. Thank you.
See you tomorrow.
Okay, sir.
Thank you so much, Mr.